everyone. I'm Julie Haake, and I am a pelvic floor physical therapist with Optimal Physical Therapy at our Buffalo location. I also see patients in Pahrump and in Henderson, and we're currently working on getting another awesome physical therapist out at our Henderson location, so we'll be able to see more of you coming in. I can start with a quick introduction. I grew up in Texas and went to school in California and in Kansas. And I came to Optimal to help start the pelvic floor physical therapy program about a year ago. So I really love pelvic floor physical therapy. Did not even know it was a thing until my second year of physical therapy school, when I was introduced to it at a conference. And I really loved the holistic, whole body approach that physical therapy of the pelvic floor really takes. It's more than just those pelvic floor muscles, and that's really what made me kind of fall in love with it. And without further ado, I guess we can go ahead and start. So we'll be talking about what pelvic floor physical therapy is, different types of incontinence, and our own internal pressure system, and then incontinence and how that affects people in the postpartum period, in aging adults, and then also in active males and females. And then we will wrap it up with a Q&A. There will also be polls at the end of the webinar for feedback, which helps us to provide better content and more of what you want to hear with these webinars. So if you could fill those out at the end, that would be very greatly appreciated. And I believe that's all of the housekeeping we have. So I'll just kind of start with a general pelvic health overview. So pelvic health or pelvic floor physical therapy is a niche or specialty of physical therapy that addresses the pelvic floor, the low back, the abdominals, the groin, the hips. So it really is more than just the pelvic floor. And if you've never seen the pelvic floor before, or know what I'm talking about when I talk about the pelvic floor, I have this model here. And this is a really good kind of visual or representation of what the pelvic floor muscles look like. So we have 3 layers in our pelvic floor, 3 layers of muscle. And this is the innermost layer in here. And then this is the outermost layer. And then there is a layer in the middle that you can't really see in this model. But the pelvic floor muscles have 3 main functions, and that is to stop and start the flow of urine and gas, to support the pelvic organs, and then to aid in sexual function. So pelvic floor PT can help with low back pain. It can help with pain with penetration, whether that is inserting a tampon, a pelvic exam at an OBGYN office, or with sexual intercourse. And then it can also help with pain with menstruation, tailbone pain, constipation, fecal incontinence, and urinary incontinence, which is what we'll be mostly focusing on today. And urinary incontinence is the involuntary leakage of urine. And this can be even just a few drops of urine every once in a while to complete emptying of the bladder without any control. So it's really a whole spectrum. And I'm gonna say this over and over again tonight. Urinary incontinence is common, but it is not normal. And this is something that can be fixed. There are several types of urinary incontinence. The most common type is mixed, which is a kind of a combination of multiple types that I'll be telling you about here shortly. But stress incontinence is the involuntary leakage of urine with sneezing, coughing, lifting, laughing, anything that adds intra-abdominal pressure or the pressure inside of our bodies or our abdomen with those activities. So when you do these activities, it increases pressure and pushes down on the pelvic floor. And if the pelvic floor muscles are weak, they are not able to hold the urine in the bladder, and then we get leakage. So I can show you kind of right here. We have the bladder that is inside of the pelvis. And if I remove that, we can see the urethral sphincter here, maybe. This angle may not work very well, but we have the urethral sphincter here, and then that comes out here, which is where your urine comes out of. And if the muscles surrounding the urethral sphincter and the sphincter itself are not strong enough, that is when we get leakage. I'll talk a little bit about the internal pressure system here, because that is super, super important for managing incontinence, especially stress urinary incontinence. So our internal pressure system is made up of the diaphragm at the top, which sits underneath the lungs, our pelvic floor at the bottom, our abdominals in the front, and then our back muscles in the back. And the internal pressure system, we have it our own kind of piston as we breathe, which is why a lot of the times when you come into pelvic floor physical therapy, we'll assess the breath and then also kind of coach you through proper breathing if that's something that you need to work on. So as we breathe, so imagine this is my diaphragm here underneath the lungs, and then this is the pelvic floor. As you breathe in, the lungs expand and the diaphragm drops a little bit. And when the diaphragm drops, your pelvic floor drops along with it. And this is a normal occurrence. So as the pelvic floor drops, it goes into more of a relaxed state. And then as you breathe out, the diaphragm comes back up, the pelvic floor comes along with it. And that goes into more of a contracted state. And then the abdomen, so in a lot of fit people, they can kind of overtrain their abs. And so that pressure of the abs is then shot down towards the pelvic floor. And that's where you kind of get that leakage in fit people, active people who are lifting weights, things like that. But we'll get more into that a little bit later. I'll go into the next form of incontinence, which is also super, super common, urge incontinence. And that is when you're just going about your day and then all of a sudden you have to go to the bathroom and you need to go now. This can happen when you hear running water. A lot of the times it happens if you're coming home from either work or from the store and you step foot in the house and you immediately need to go. A lot of the times this is caused by a bladder-brain connection, and we start kind of forming these patterns or subconsciously, and your brain remembers that every time you step into the house that you go to the bathroom. And so soon that urge will start to just kind of click in. And so pelvic floor physical therapy, there's a lot of behavioral modifications to kind of rewire the brain so that you don't have to go right then and there. And then we also have overflow incontinence, which is leakage when you don't completely empty your bladder. And this can happen if you don't realize that your bladder is full, or if you have really overactive pelvic floor muscles that don't allow the bladder to empty all the way. We also have functional incontinence, which is when you physically can't make it to the bathroom. Let's say you sprained your ankle or broke your leg and you have to go to the bathroom and you just can't get there fast enough. That's functional incontinence. And then we have mixed incontinence, which is I talked about at the beginning. It's the most common type of incontinence, and it's any combination of those types that I talked about previously. And the kind of most common form of mixed that I see is both stress and urge incontinence. Those two are paired together really, really frequently. So I can talk about a little bit about incontinence in the postpartum period, so after childbirth. So I know I said it's common but not normal. There's an exception to every rule. This is one of them. It is normal for about 6 weeks after childbirth. So you still have all of those hormones running through your body, especially if you're breastfeeding. And one of those hormones that's really kind of the culprit is relaxin, and that can cause all kinds of issues with pain during pregnancy. But this is a normal thing. Relaxin is a normal hormone. So that hormone is still being produced up to 6 weeks postpartum, longer if you're breastfeeding, and that can cause leakage. But the leakage is not normal after 6 weeks postpartum. So this happens a lot with new moms because they just gave birth. That is trauma to the pelvic floor and to the body, and the mom also supported a growing child for 9 months, which is a lot of pressure and stress on the pelvic floor. And over time, if we're not continuing to, train and work on those pelvic floor muscles, they just continue to weaken until the point of leaking. This can also happen when people get the go-ahead to exercise at their 6-week postpartum visit, and they're cleared to go exercise, and so they go and take off on a 3-mile run. Well, you may feel ready for that. You may want to get your pre-baby body back, but your pelvic floor and your core are not ready to handle that stress yet. Running is a high impact activity, as is jumping, and then we also get that pressure with coughing, sneezing, laughing. The running and jumping is even harder on your body than those things. So if you are still leaking with coughing, laughing, sneezing, your core and pelvic floor are not ready to run yet. And that's kind of where pelvic floor PT steps in. We help to get your core ready, slowly reintegrate you into exercise so that you don't have any issues down the road with exercise and can continue a healthy and active lifestyle. Incontinence in active adults. So I talked a little bit about overtraining your abs. This can also be if people are looking to kind of suck in a little bit, give their abs that kind of flatter appearance. And that does not allow the diaphragm, your abs, and your pelvic floor to coordinate well, which can then lead to leaking of the of urine or anything like that. It can also happen with Valsalva maneuver or breath holding with lifting. You see this a lot in power lifters or people who are lifting really heavy. They're holding their breath while they're lifting, and that does not allow for that kind of pistoning system that I talked about earlier. And if the pelvic floor is either too tight and not moving, or it's not strong enough to handle that heavy load, then we see leaking there. And our pelvic floor needs to be mobile and it needs to be strong. So, side note, yoga is amazing for the pelvic floor. For that reason, it focuses a lot on both strength and mobility. And then in older adults, people just think that this is normal. You get older, you start leaking urine, you've had kids maybe, or if you're a male or had a prostate and had it removed, we see leaking with that too. This is not something that's normal, and especially in America, we just stop moving as much as we get older. And so when you're less active, you're continually placing less and less demand on the pelvic floor. And that's where we kind of get into that use it or lose it. So keep moving, keep lifting heavy things, and hopefully you will not experience leaking with age. But if you do, pelvic floor physical therapy can step in and help you retrain those pelvic floor muscles to prevent that leaking. And then as far as a pelvic floor physical therapy session or the first visit, the examination is in two parts. So there is an external examination and an internal examination. And all of that happens after speaking with your physical therapist, going over your history, making sure that you guys are both on the same page with what your goals are, where you're at, where you want to be, and kind of what you've been experiencing. One thing that I really like to do and really enjoy this part about my job is that I get to sit there with my patients and we can literally talk for the entire hour of that first visit. If you haven't been heard by other healthcare providers, that's really kind of one thing that I hope that my patients feel like they get out of their first visit, is that they feel heard, and that they are not alone in any of the pelvic floor dysfunction, incontinence, anything like that. It's just not really talked about very often, but it is incredibly common. So back to the examination part of it. The external examination, we take a look at your spine, your hips, your abs, how you're breathing, how you're moving, your strength, things like that. And then we have the internal examination. And that is one thing that not a lot of people are aware of. Their doctors don't tell them that before they come into a pelvic floor physical therapy session. So they're often surprised. And so normally this doesn't happen on that first visit. I'll wait until the second one, just so that we can, get acquainted, what to expect the next time you come in. But with the internal examination, you are dressed down from the waist down, and I'll be taking a look at the muscles on the outside, making sure that there is no tenderness or pain to touch. And then I also take a look at how the pelvic floor is moving. After that, a finger is inserted into the vagina, and we take a look at just the raw strength of the pelvic floor muscles. So doing a pelvic floor muscle contraction or a Kegel, you'll hear me call those pelvic floor muscle contractions, but they're the same thing. And after seeing how strong that is, then we see how long you can hold that contraction. And let's say you can hold it for 3 seconds. After holding for those 3 seconds, take a 5-second break, and then see how many times you can hold for 3 seconds with a 5-second break in between. After assessing that, then we see how many quick contractions you can perform in 10 seconds. And after that, I am able to feel the pelvic floor muscles. So these in here, through the vaginal wall, to be able to assess any tightness, pain, or discomfort, if there is any. And we do an internal examination to really get the best picture of where you're at, what your starting point is. We kind of retest and reassess each time that you come in to check progress and be able to progress you throughout the plan of care properly. And we do have a Q&A session, so I can open the floor up to that if anybody has any questions. Oh, I see a hand raised. I'm trying to, you can either type in the chat box or unmute yourself if you are able. Hello. I think that may have been an accident. Oh wait, I see the question here. Okay. How do you know the strength of your own pelvic floor contraction? Or how do I know if it's stronger or weaker relative to others? That is a great question. So, there is a test that you can do on your own called the stop test. And this can be done while you are urinating. And as you are urinating, you can try to stop the flow of urine. And if you have a stronger pelvic floor, you'll be able to stop the flow of urine completely. And the other two things that may happen is you may be able to slow the stream of urine, and then sometimes nothing will happen. And those two are kind of how you know that you may have some weakness going on. I will say that I recommend not doing that very often because it can irritate the bladder if it's done every time you sit down to go to the bathroom. But if you try that test maybe once a month and then just kind of forget about it until the next month, then you can reassess that on your own. Anybody else? I'll give a few minutes here if anybody wants to type anything. Is this therapy just for women? No, it is not just for women. So it is also for men. I know that I mentioned as far as the internal examination goes, that it is done intravaginally. For men, the internal examination can be done rectally. And men also have problems with urinary incontinence. It's very common after having a prostate removed, and in athletes who lift heavy, CrossFit athletes who may not be managing their intra-abdominal pressure while breath holding with lifting and things like that. Do internal vaginal weights really work? Yes, they do. And I normally recommend those at a certain level of strength and a certain level of coordination. So they're not appropriate for everybody right away, but if you get to a certain strength point, they are very beneficial, especially in people looking to return to high impact activities and are really kind of only having issues with like jumping or sprinting and things like that. And then how long do you anticipate therapy or number of visits to see improvement? This varies from person to person. I hate to give an it depends answer, but a lot of people will see improvements, especially with urge incontinence, within 1 to 2 weeks. Strength does take about 6 to 8 weeks to really be permanent, but we also see some neurological changes in the nervous system that can make a big difference in, 3 to 4 visits as well. A few more minutes here. Thank you all for the awesome questions. Oh, I might have one more here. Are there exercises people should incorporate into their everyday lives to maintain a healthy pelvic floor? So there are a ton of exercises, a lot of kind of lower extremity exercises like squats, bridges, things like that. It kind of depends on your fitness level and kind of where you're at. There are situations where those pelvic floor muscle contractions may not be appropriate in situations where people are having a lot of pelvic pain, but for the most part, those pelvic floor muscle contractions are good for maintaining a healthy pelvic floor. And then being able to do those along with deep breathing. So on that breath in, feeling your pelvic floor relax or voluntarily relaxing it. And then as you breathe out, kind of like a long, slow breath, almost like you're blowing out a birthday candle, drawing those pelvic floor muscles up and in. I give this cue to my patients a lot and they always laugh at me. But imagining that you are picking up a blueberry with your vagina, that is kind of a good cue to kind of gently perform those pelvic floor muscle contractions rather than squeezing as hard as you can. And then are Kegels the only exercise you do? Definitely not. We really take kind of more of a whole body approach with pelvic floor physical therapy. So like I said, with the external examination, looking at the spine, the hips, the breath, the legs, everything like that. So kind of seeing where the weaknesses are and being able to incorporate those weaknesses into therapy to make them into strengths. Why is it that even after done urinating, there is still an urge and a little more urine to finally complete? So this could be due to the pelvic floor not completely relaxing as you are urinating. There are several reasons why that could be happening, but that's the most common one, is that the pelvic floor is not fully relaxed. And this happens often in public restrooms where people don't sit down on the toilet seat and hover over it. That does not allow your pelvic floor to relax completely. I have an anonymous question that I will answer here. How long after giving birth would you recommend getting therapy? This varies from person to person, but 4 weeks is generally an appropriate time to come into pelvic floor physical therapy. The internal examination won't happen until you've had that clearance from your OBGYN for exercise and for inserting tampons or penetration, anything like that. But there are things that we can work on externally as far as the breath and gentle core exercises to kind of get the ball rolling at 4 weeks. Also before 4 weeks, you want to be spending as much time as you can with that newborn too. You just gave birth and became a mother if it's your first child, and we really want you to kind of focus on enjoying that time. I heard that the best position to urinate is completely sitting down with legs open and leaning forward. Do you agree? Yes, I would agree. If you have heard of the squatty potty, that's also great for bowel movements as well. It puts your pelvic organs in the most optimal position for the pelvic floor to relax and completely empty. I'll give you guys if someone is nervous or uncomfortable addressing this issue, what do you recommend to get past their fears of treatment? That is a great question. So there are other ways of assessing the pelvic floor muscles rather than an internal examination. The internal examination just really gives us the best picture to kind of move forward and more quickly get the results that you are looking for. So internal work is not always necessary. And then that's really just kind of like a comfort issue. It's difficult to come in and talk to someone you just met 20 minutes ago about issues with peeing and pooping and sex, and it's a complete stranger. But knowing that, you know, you're not alone. I'm, you know, not there to tell the world about your issues or anything like that. So that would be kind of what I would recommend, is you can make a discovery call and kind of chat with me for about 15 minutes and talk about your fears, and we can kind of work through them and come up with a plan that suits both of us. And then, am I the only pelvic floor physical therapist in town? I am not, but there are, I think, 7, soon to be 8 of us once we get one more for Optimal down in Henderson. So there are not very many of us for the, I think, 2.3 million people we have in Las Vegas. But there are others. All right, well, if nobody else has any other questions, then we can call that a night for the webinar. Thank you guys for all showing up and asking awesome questions. I know that that's a lot of information in a short amount of time. You can always reach out to me at julie@optimalptlv.com if you have any questions or concerns, or are wondering if pelvic floor physical therapy is appropriate for you. I'm more than happy to chat with you on a call or answer your questions via email. Once again, my email is Julie, Julie, @optimalptlv.com. And it's in the chat box. Thanks, Mike. And don't forget to answer those polls at the end of the webinar tonight. That feedback is extremely helpful to us. So thank you so much. And if nobody has anything else, then we'll call that good. Oh, there are more questions. So sorry. Are there any other signs other than incontinence that result in a weak pelvic floor? Let me see. Are there any other signs that result in floor? So, pelvic organ prolapse is another huge one for that, and that is basically when your muscles and ligaments and tendons are not doing the best job that they can at supporting the pelvic organs. And so pelvic floor PT can address that by strengthening those muscles and helping to better support those pelvic organs. And then, what are some more serious consequences of weakened pelvic floor muscles with no therapy and more than one pregnancy? More serious consequences. So there's urinary incontinence, there's also fecal incontinence, pelvic organ prolapse. Those are all things that can happen. They are all very common, just nobody ever talks about them. And then as far as more than one pregnancy, prolapse is really common with that as well, especially with larger babies or longer pushing times. in labor. And then, yeah, I could do a whole other webinar on pregnancy and postpartum pelvic floor physical therapy, but yeah, there are things that pelvic floor PT can do to help reduce perineal tearing, which can then lead to other issues down the road, and things like that. So. Okay. Well, thank you guys, and don't forget about those polls. I appreciate you guys tuning in tonight and asking some awesome questions. You guys have a good night.